Good morning to our viewing and listening public, both home and abroad, and a very warm welcome to another Ministry of Health update on the national COVID-19 campaign. It is certainly a pleasure to be here with you once again. I am pleased to present today's panel of presenters, the Honourable Terrence Deyalsingh, Minister of Health, Dr. Miriam Abdul-Richards, Principal Medical Officer, Ministry of Health, Dr. Adesh Sirjusingh, Director in the Directorate of Women's Health, Ministry of Health, and Dr. Osafo Fraser, County Medical Officer of Health for St. George East. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for today. We begin with the Honourable Minister, who will update us on the vaccination figures and other issues surrounding our national COVID-19 response.
Thank you very much, Al. Good morning to all. Ladies and gentlemen of the media and the public that is listening, today is Wednesday, the 22nd of September, 3 days after we alerted the country of the findings of 2 cases of the Delta variant amongst our local population and 1 in a migrant, adding up to 3 cases. This is a very dangerous point that we are at. Cast your mind back to the days when we were at these press conferences talking about a rolling day 7-day average of 3 cases. No one paid attention. It started to go up to 6, 16, 33, 100, and in a very short space of time exploded to over 400 to 500. It was at that point in May that the government took some decisive action because our hospitals were on the verge of being overwhelmed. That is the parallel healthcare system. Today, Wednesday, 22nd September, it will be remiss of us as healthcare professionals if we don't learn from that time when things seem to be relatively good, and even though we were alerting the population, don't be complacent. Because 3 exploded to over 400 in the space of weeks, and that was without the Delta variant. Today, Dr. Miriam Richards is going to explain to you one particular data point. It's not a trend. It's a data point which, if it becomes a trend, will place Trinidad and Tobago's parallel healthcare system in a position where if you have COVID, as the Delta variant will spread amongst us as a largely unvaccinated population, you may not get treatment. You may not get treatment because the elasticity of the parallel healthcare system is not as elastic and stretchable as it was 2 to 3 months ago. It is simply not there. You can add beds, physical respirators, but there are no more people to man those beds. As Dr. Richards says, months and months ago, a bed is not a bed. Please pay attention to this data point that Dr. Richards will present today. Because if it turns into a trend, as we saw with a rolling day 7-day average of 3, which exploded to over 400, which brought us to the brink of collapse, then we're in a bad place. We also have Dr. Osafo Fraser, County Medical Officer of Health for County Caroni, who is going to speak, hopefully in some grave detail, about one particular Delta case coming out of a gathering. It is my duty to bring to the national attention 2 cases of gatherings that have the potential to sink our parallel healthcare system and to ensure that persons who contract COVID may not get the help that they want. The first such gathering reported in the Express on the 16th of September, 14 nabbed at house party in St. Augustine, 14 persons. What is instructive is that when you look at the areas as identified in that article, they came from San Juan, Champlain, Arima, Diego Martin, El Socorro, and Cunupia, 4 counties. We always provide data as to infection rates in counties. In that one party, you had web stretching out to 4 counties, over half of the country. In Mayaro, the police had to intervene in a beach line. And listen to what the areas are again. Arima, Long Circular Road, Maraval, Dow Village, Couva, Aruca, Pinal, Princestown, Williamsville. Again, 4 counties. Ladies and gentlemen, the point we are trying to make is this. It shows how easily, in a small, mobile country, any gathering can lead to nationwide spread. And with the Delta variant, which is more transmissible, it poses a clear and present danger to our health system. When you marry that with our low vaccination rate, where the majority of the population is unvaccinated, plus Delta, plus these gatherings, it is a recipe for disaster. Ladies and gentlemen, I know we are tired. All of us are tired. But you know what? The virus isn't tired. Whilst we are tired, the virus is changing, it is mutating and rejuvenating itself to come back at us stronger, wiser, more lethal. We are all tired. And I know the population is tired. I know the population wants to get back to what we do best, how we work, how we play, how we interact with families, our loved ones, and so on. But we can't afford to get tired because the virus is rejuvenating itself every day. When one looks at our vaccination rate now, up to figures last night, 562,582 persons have had their first dose, which represents just 40%, 40.2% of the population. So we barely crossed the 40% threshold yesterday. Of that, about 37,000 are children between the ages of 12 to 18. So it means of an adult population who are eligible to be vaccinated, of 1 million persons, just over half of that have been vaccinated. That is not good enough with the Delta variant, not at our doorsteps again. It is actually in our living rooms. It is in our living rooms. The decisions we make individually, communities, will determine whether we could keep it in the living room or whether it gets into our kitchens, bedrooms, closets. That's a good analogy we could use. It was in our doorstep. It has now entered our house. How are we going to respond? The decisions that we have to make collectively as a team moving forward, especially with this Republic Day weekend, and I am deeply concerned about the little social gatherings that we know are going to happen this weekend, the little lunches, the limes, the drink-ups, because people are tired. And I mean, human nature is such that we want a release. We want a release. We want to express ourselves. We appreciate that. I want to urge for this Republic Day weekend that we do not congregate as persons in that party in St. Augustine and Mayaro, because you see what happens. The tentacles of the virus goes into every community. Continue to mask. Continue with the hand hygiene. But now, more than ever, we have to make a decision. For those who are still on the fence, it is not too late to make that decision today. As I urged on Monday, as healthcare professionals around the world have been urging, where countries have reached this plateau of vaccinations, healthcare professionals around the world, presidents, prime ministers, leaders of all sorts, religious leaders, Archbishop, the Anglican Church, the Muslim Church in Trinidad and Tobago, everybody, follow the advice. Vaccines are safe, vaccines are effective, and they can save your life and save Trinidad and Tobago. So that's my simple message for this morning. Please pay attention to Dr. Richards on her data point. And let us hope that this data point is not a predictor of things to come. And please pay attention to Dr. Osafo Fraser, where he explains the consequence of a gathering. Thank you very much, Al, and we look forward to questions later on.
Minister, we now go to Dr. Abdul Richards for the latest clinical and hospital occupancy updates. Dr. Richards, good morning.
Good morning. Thank you, Al, Honourable Minister, Dr. Deyalsingh, Dr. Fraser, members of the media, members of the viewing and listening public. Good morning, Trinidad and Tobago. This morning, I would like to present an update on the parallel healthcare system, as well as the media release number 854 as of 4 p.m. on the 21st of September. An additional 197 cases were reported in the last 24 hours, and this takes the rolling average up to 209, and that's a 7-day rolling average. The total number of active positive cases is now 4,003, and the cases are divided as follows: 3,452 in home self-isolation, 288 persons in hospital, and 66 persons in step-down facilities. At present, there are 153 patients in state quarantine facilities, and as of 4 p.m. yesterday, 4 additional deaths to COVID-19 were reported. The current death toll is now 1,426. And again, the Ministry of Health would like to express our sincere condolences and sympathy to the family of the deceased. I would like to now present a status update on the parallel healthcare system, which consists of 16 institutions across Trinidad and Tobago. The information provided is as of 8 a.m. on September 22nd, 2021. So I'll start with the first slide, and briefly it demonstrates the 7-day rolling average of the number of cases. And yesterday we had 197 cases, but when we calculated the 7-day rolling average, we are noticing a slight uptick or a slight increase, with the rolling average now being above 200 and at 209. And I would like the population to note the 7-day rolling average and that increase, because an increased number of confirmed cases will result in an increased number of hospitalizations, which may result in adverse events such as severe illness and unfortunately death. We'll now go to the second slide of the presentation, and I have particular concern, as the Honourable Minister expressed, about this slide. Now, this slide shows the actual number of persons in hospital. And when we consider what the hospitals in the parallel healthcare system, these are institutions to treat the severely and critically ill patients. There are 9 hospitals in the parallel healthcare system to treat severely and critically ill patients. And these are the patients that have a greater risk of being transferred into the high dependency units or the intensive care units, where, of course, the risk of them having an adverse event like severe illness due to long stay or death increases. Now, we have noted an uptick over this week, and as Minister kept reiterating, this is a data point in the number of patients that have been hospitalized in the parallel healthcare system. The Ministry of Health is very detailed oriented, and our analysis is based on the data that we receive daily and also on WHO recommendations. And we are very concerned about this uptick, especially given the context of the Delta variant that has been noted in our community. Another point of concern has been the ratio of severely and critically ill patients to recovering patients. From July 15 to present, we noticed a ratio of 3 to 1, meaning that there were 3 times as many severely and critically ill patients to recovering patients in the parallel healthcare system. Of course, this means that critically ill and severely ill persons require more resources. They require longer stays in hospital, more staff to manage them or to take care of them, ventilators, dialysis machines, and other equipment to save their lives. As of this week, again, we've noticed a data point where there are now 4 times as many severely and critically ill patients in the parallel healthcare system as recovering patients. And there are implications for this new uptick in as far as the risk of development or the risk of a person transitioning to ICU and HDU, and also from the parallel healthcare system resource side, an increased demand for resources, which of course will ultimately be limited. I'd just like to recap on the next slide the percentage occupancies in Trinidad and Tobago. As of today, the overall occupancy, when we consider all 16 facilities, is at 35%. And yes, we have noticed an occupancy of less than 40% since July 15th. However, if we continue with the uptick in cases and it becomes a trend, we are at risk of crossing that threshold pattern that we crossed in the middle of May, where we went beyond our safety zone of 75%. And although the parallel healthcare system was resilient and held, there was a potential for collapse. The percentage occupancy in Trinidad is 35%, while in Tobago it's 41%. And of course, we are seeing a general increasing trend in Tobago over the past month. The next slide looks at the percentage occupancies across level of care. There are almost 900 ward level beds within the parallel healthcare system, and ward level beds manage the least ill of the patients requiring care. If a patient becomes more ill, they transition to a high dependency unit and then to the intensive care unit. And as of this morning, the intensive care unit occupancy is 88%. The average intensive care unit occupancy continues to be above 80%. That means 8 out of 10 ICU beds continue to be filled. The HDU percent is currently at 29%, but of course, when we look at the average, it is 60%, so 6 out of 10. Ladies and gentlemen, as I close this morning, I again would like to reiterate the concerns that the Ministry of Health has noted with respect to the parallel healthcare system. These concerns are even more relevant given the presence of the Delta variant. We continue to notice high intensive care unit occupancies. We are now seeing an uptick in the number of patients in our hospitals, and also we continue to note pediatric cases being admitted. We accept and we appreciate your compliance so far with the public health regulations and the 3 Ws. And as the Honourable Minister indicated, We would like you to please continue to comply with these measures. However, we need that additional layer of care, and that is vaccination. We urge you to please vaccinate today and not delay. Thank you very much, Al.
Thank you very much, Dr. Richards. I now invite Dr. Fraser to update us on the efforts being made to treat with the virus in his county, as St. George East, and to share an example of how the COVID-19 virus and or the Delta variant can easily spread in a community. Dr. Fraser, good morning.
Thank you, Al, and good morning to the Honorable Minister Deyalsingh, and to my colleagues, Dr. Richards and Dr. Singh, to the media and members of the listening and viewing public. I do want to spend just a little while giving some details on the circumstances surrounding the Delta case that is in the county of St. George East. We know that this is an unvaccinated minor, and our investigations have shown that this individual would have most likely got infected when a gathering of friends and neighbors was held that the individual attended. This person was playing and interacting with other minors who we have also found to be were positive prior to this individual, and those minors were unvaccinated. The parents of those minors were also unvaccinated, and also we found that subsequently positive. And essentially what happened at that gathering is a number of people got together, people interacted, public health measures would have been breached, and a number of unvaccinated individuals would have been able to spread infection among themselves. The fallout from this is a number of people infected. Some of them were very ill and ended up in hospital. One of the minors was actually in hospital already, and as a result of this breach of the public health measures, we now have the information that one of the individuals has the Delta variant. I think there are just a couple of things to note from this one scenario. One, minors are not to be ignored. They are vulnerable. A number of them can't be vaccinated because of their age, and so they do present a weak point in our defense, which means as adults we have to surround and form a barrier around them. So we need to make sure we are doing all we can to be vaccinated. When minors play, they can spread infection, and so the fact they may be young does not absolve them from getting infected, and as a result being a big point of spread. In fact, in some cases they can be even more efficient spreaders than adults, and so that is something that people need to bear in mind. The other big thing that you can draw from this is that the unvaccinated is really a big risk. I mean, just in my county alone, over the last 6 weeks, most of the people who were positive, 90% of them were unvaccinated. We have had maybe about 49 persons from the community who were positive going into hospital for additional care. And of those 49 people, 46 of them were unvaccinated. And so there's a large disparity between the vaccinated and the unvaccinated, both in those who are becoming positive and in those who are becoming sick as a result of infection. And so I just want to implore the population this morning. Gatherings are not helpful. They prevent a big point for transmission. Being unvaccinated is a big risk, not just for you, but for members of your family, and as you can see in this case, members of your neighborhood and of the society at large. And the one encouragement I would give to everyone is make the efforts to get vaccinated and make the efforts to follow the public health regulations. Keep your gatherings and your interaction to the 5 that we've talked about. Make sure that you are wearing your mask and keeping your social distance, and that you are sanitizing as regularly as you can. Because what we can see from this incident, that especially in the case of Delta, things can spread and spread very quickly and have very serious consequences. Okay, Al, that's my update for this morning.
Thank you very much, Dr. Fraser. And as we approach this long weekend, Republic weekend, I want to implore that you please obey the health regulations, stay apart, avoid those group limes, etc. It's a very small sacrifice to make. We now move on to Dr. Deyalsingh, who will update us on the progress being made in the vaccination of pregnant women in Trinidad and Tobago. Good morning.
Good morning, thank you, Al, and good morning, Honourable Minister and other members of the panel. Good morning to viewers, listeners, and members of the media. Can I have my slides, please? So, we'll be giving an update on our COVID-19 pregnancy and breastfeeding. Next slide, please. So, this just to set the scene again, because I think people tend to get a little alarmed when I come on TV and give these numbers. I've been here several times and I've been providing up-to-date information for those who listen in. It's scientific information. It's an evolving situation. You have to be aware that data is always preliminary, and even internationally, sometimes there is what's called backlog reporting where cases are identified. In the United States, it's at least 4 weeks before they publish their data. The verification is ongoing. I'm a medical person. I have 31 years of medical experience. 27 years I have been a specialist in the field of obstetrics and gynecology. I have practiced in Trinidad and Tobago and continue to do so. The monthly data birth update, the next slide please. So these are figures that we collect at the Ministry of Health, and data is important. It's essential in making informed decisions. So to update the population, this is a reflection of what our healthcare system has been doing, our hard-working medical staff, additional staff assisting us. The maternity and newborn services have continued to operate with the assistance of this parallel healthcare system that has been established. And this is sometimes, if you scan the pages across the globe, you will see that in many developed countries, some of their maternity and newborn systems have shut down. We are privileged in Trinidad and Tobago. So we've had 9,445 live births up to the end of August. Of note, 58 of those live births were very small babies under 2.2 pounds or 1,000 grams. And the majority of this work is being done by your public healthcare sector. Most of these difficult cases, most of these preterm babies, 91% are delivered in the public healthcare system, with just 9% in the private sector. Next slide. And just to set the little scenario, this is again the data we have been collecting. We use data to help us plan services. We have been seeing a decline. This is a slide which actually, for those who can't see the screens, shows 3 years of data, which shows a relatively steady decline in total number of births up to this point in time. Next slide. And this is the up-to-date information in this slide. It's maybe a little difficult on the screens to see it, but the lowermost line is colored dark. It goes up to August, and it also reflects that the trend we are seeing is that there's a slight decrease on an annual basis with number of births. Next slide. So this is the important slide, as I say. These are the cases in our database of pregnant women who have contracted COVID-19 since the start of the pandemic. You will note that the number is now 657 cases, and this may appear to be a significant rise since I was last here a few weeks ago. However, a significant portion of this has been due to cases now being classified, which were not previously classified, women who are pregnant, and we have 14 centers sending us data now, clarifying the information. So this is what has been happening. In 2020, there were 58 cases in the database. For the first 6 months of the year, we had 283. But you will note that there has been an increase in the number of cases that we are seeing so far for the last couple months. And as of September so far, we've already seen an additional 116 cases. Next slide. Vaccine information, we have said this before. We have released Sinopharm to be used in the breastfeeding population. Since June, we've had that policy. We added the Pfizer-BioNTech since the second trimester and above. We have, today makes 1 month since that has started. And then we also released Pfizer to be used in the breastfeeding population as of September 8th. Next slide. So the rollout again, just to remind everyone, you are using the existing vaccination sites for Pfizer if you're pregnant, and for breastfeeding Sinopharm. Just keep up to date with the information. I know sometimes the sites change. If you went to one center and it's now closed, find the closest center. You will be accommodated. In addition, most of the RHAs are now rolling out the Pfizer vaccines in the antenatal clinics. And after you have delivered, you can also get your first dose of either Sinopharm or Pfizer on the postnatal wards. Ideally, try to get vaccinated before you become pregnant. And as of September 20th, we actually had 530 pregnant women who received their first dose of Pfizer. Next slide, please. And again, just to reassure you on the safety, over 300,000 pregnant women worldwide have received these types of vaccines. It is highly monitored, safe. It protects you and your unborn baby. And there's no different side effects than what is seen in the general population. I want to say again, the process is voluntary, but remains highly recommended. Next slide, please. And just to close on this point that we have been saying, the trend in today's discussion here, I want to look at yourselves. Now, each of the things that I have on screen is an independent risk factor that if you are pregnant and you contract COVID-19, you are more likely, if you have these risk factors, to end up in the HDU, the ICU, or even dying. If you are over the age of 35, once you cross into the second half of pregnancy, you become high risk. For medical purposes, we're just going to say a blanket statement here, but if you're overweight, over the weight of 80 kilograms in pregnancy, especially at the start, or 176 pounds, if you know your body mass index, if it's more than 25. Now, diabetes. We have been saying this over and over. Diabetes is rampant in Trinidad and Tobago, and more so in our pregnant population. Our figures show 17 to 20% of the pregnant population have diabetes, either pre-existing or develop this for the first time during pregnancy. This is a startling statistic. High blood pressure, heart disease, asthma. Of these patients I have told you about, 2% ended up in the ICU or the high dependency unit, and unfortunately we have recorded 2 maternal deaths of patients who presented in the later part of pregnancy. They were successfully delivered, but they succumbed to the complications of COVID-19 in the postpartum period. I express my heartfelt condolences to these patients. Thank you, Al.
Dr. Sujit. Thank you very much, Dr. Deyalsingh. We received a question from the media recently regarding the effects of vaccines and possible reports of menstrual changes. Could you elaborate on that and share some information with us?
Right. Okay. So again, thank you, Al, for that important question. And I have myself been scanning the media and seeing these reports in the media. At the Ministry of Health, however, we haven't received any direct reports of women or healthcare practitioners saying that there has been an increase in the incidence of cases being reported. But I just want to talk a little bit about the story I read in the newspaper yesterday. It was reported that there were 30,000 women in UK who reported some sort of menstrual disturbances. But the full story wasn't reported. This was in the BBC.
Sorry.
There were actually 47 million doses of vaccines given to women in the UK. So this represented 0.06% or 6 women in 10,000 who expressed menstrual disturbances after they received the vaccine. And their agency categorically said that they do not link the vaccine to menstrual disturbances. However, I need to say, of course, if you are a woman, and this holds for people who are vaccinated or not vaccinated, menstrual disturbances are fairly common at all stages of a woman's reproductive life. They could be related to hormonal changes, stress-related problems, which we are having a lot of course. weight changes, either gaining weight or losing weight, polycystic ovaries, thyroid disease, fibroids. These are really common conditions in Trinidad and Tobago. So my advice to you is, of course, if you're experiencing some serious effect to your normal menstruation, especially if it's heavy, to please consult your doctor. There's one thing though, if you're post-menopausal, meaning that you haven't seen your period, you're over 50 years of age, and more than 6 months have passed, and you see bleeding for the first time, vaccine or not, report that. That is a serious concern to me, and seek medical attention. Thank you very much.
Thank you very much, Dr. Deyalsingh, for that clarification. We now move to the question and answer segment. Our media representatives are reminded to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask your questions one right after the other to the relevant members of the panel. We will accommodate a second round of questions if time permits. Today we begin our question and answer segment with CL Communications. Good morning. CL Communications. Okay. One. AZP News. AZP, are you there?
Good morning, yes.
Good morning.
This is Juan Wayo calling from acpnews.com. And despite all of government's efforts so far to have the population vaccinated, there are still many people who are pushing anti-vaccination messages. There are still people, especially in the Christian arena, who believes that the vaccine is an anti-Christ move. And there are still who just don't believe the government at all and the messages that you all have been giving out. What more, if anything at all, can the government do to convince the public that vaccinations are to aid and not destroy, especially in light of some reports of adverse effects? And my second question is, given that government is still moving ahead with the October 4th date of the reopening of physical school for selected forms, how confident is the ministry in terms of the vaccination numbers of the 12 to 18 age bracket, as well as teachers and other school officials? Thank you very much.
Thank you. Thank you. So we must always be careful how we talk about adverse events and side effects. You mentioned reported adverse events. To date, as we have said openly, we have administered over 1 million doses of vaccines, both first dose and second dose, in Trinidad and Tobago. 1 million. To date, there have been 5 reported adverse events. Like any other vaccination, you will have side effects, which are pain at the injection site, fever, and so on, which occurs with any vaccination. So what is happening around the world is that things are being amplified and magnified and being taken out of context. So there have been 5 adverse events in 1 million doses of vaccines. No one has died. All those 5 cases have been managed and they have basically recovered. So I hope that that once again puts into context the difference between a side effect, which is common with any injection, any vaccine, which is pain at the injection site, soreness in your arm, a little bit of fever, which normally resolves in about 24 to 48 hours. You may also feel a little bit tired, as I did with the AstraZeneca vaccine, with your first dose, but generally your second dose, it's much easier. People are reporting much less side effects with the Sinopharm vaccine. So the Sinopharm vaccine in our local setting seems to have a much better side effect profile. To date, as far as I am aware, from talking to the CMO, the reporting of adverse events for Sinopharm is basically nil. On the issue of schools reopening, I would suggest that all questions to deal with schools and vaccinations within schools be posed to the Honorable Minister of Education, my colleague, Nyan Gatsby Dolly. Thank you very much.
Thank you, Minister. We go across to Tobago. Radio Tambrin, we are ready for your 2 questions. Good morning. Radio Tambrin. Okay, seem that we'll move to Power, no, not Power 102. Okay, apparently we're having some challenges with the Zoom at the moment. Dr. Deyalsingh, would you mind expanding a little more on some of the other challenges or experiences that women may have after taking the vaccines?
Okay, sure. Thank you, Al, for any additional information I might be able to add. For pregnant women, if you receive the vaccine and you experience any of those side effects, the side effect profile is actually very similar to the general population, as Minister would have said. However, if you get fever or you think your temperature is elevated, I would recommend that you can, and if it's not contraindicated, you can take paracetamols to help bring that fever down. Generally, as well, the vaccine is so safe that we are also measuring what's called antibody levels in pregnant women. When you take the vaccine, you're getting a very good response. Thank you.
All right, thank you very much for that additional information, Dr. Deyalsingh. And I pass you on to the Minister.
Thank you. One of the questions that was posed to me in one about adverse events is what more can the government do to encourage vaccination? Governments around the world and healthcare professionals around the world are all faced with the same issue. Everything tells us we need to continue communicating facts, giving information, and asking people only to rely on sources that have been verified, authenticated. And the questioner made a very astute observation about it is mainly in the Christian segment of the Christian faith. I was taken aback hearing a pastor on 95.5, and this has nothing to do with the media. You have a right to carry everybody's voices. Free speech. So don't misinterpret what I'm saying. Has nothing to do with 95.5 or the media or any other media house that carries this, because it is newsworthy and you determine what is newsworthy. But you did have a Christian pastor, and at least he had the guts to come out and openly say and discourage people from being vaccinated. My fear is what is happening behind the scenes. Because when we talk to people and do our surveys, the bulk of people who seem to be vaccine hesitant are of the Christian faith, with the way the Bible and the teachings of the Bible have been interpreted or misinterpreted. And there are many such pastors doing that, both in Trinidad and in Tobago. So we have to continue engaging. You would see our communication strategy is evolving under the rubric of don't delay, vaccinate today. What we are doing is also going out more and more into the public. So for instance, yesterday, we did a vaccination outreach at the Nur-e-Islam Mosque, which just abuts the constituency of St. Joseph, a mosque that I know well, Imam Shiraz. And in that mosque outreach, we did about 170, I believe, which is a good turnout. You would see in the newspaper today it is advertised. We have about 14 sites set up in the public domain, from Brian Lara Promenade to Sangre Grande to Shogunas to San Fernando, bringing the vaccines closer and closer to people. This weekend, kind of month-end weekend, where they are shopping, Marabella, all over, about 12 sites tomorrow, Saturday, and next weekend. So if we continue doing this, right now we are doing about, let me give you the exact figure. For this week, between first doses and the one shot and done, Johnson & Johnson, we are doing about 2,500 shots per day. That's 2,500 more people every day moving towards being fully vaccinated. That's the glass half full side of it. But the glass half empty side is that is simply not good enough. We have lamented that we are about 5 to 10 percentage points behind. We need to get that up to about 5,000 shots a day, but consistently do that. So we are hoping that these drives, the continuing public education, the continuing messaging as it evolves, you would see we have the hot zone ad running on TV now, alerting people, this is your fate in an ICU if you don't get vaccinated. So Al, thank you very much.
Thank you very much, Minister. We go back across to Radio Tambourine. We do apologize. We did have some technical difficulties, but I know that we are back up and running. So Radio Tambourine, we are ready for your two questions. Good morning.
Yes, good morning. Clayton Clark, Radio Tambourine. My two questions, I believe both to the Minister. Forgive me if it was explained, but I'm just following up on a question by the public. How many patients who tested positive for the Delta variant have recovered? And my second question, yesterday, September 21st, was World Alzheimer's Day. Can the Minister or the CMO give an update on Alzheimer patients, if there were any directly affected by the COVID-19 virus? Also, how they have been coping in the pandemic.
Thank you. Thank you, Clayton. So as we announced on Sunday, we got 3 more Delta cases. That brings our total count up to what, 10? 10. Dr. Richards might have further information on how they are doing. On whether we have any Alzheimer's patients with COVID, I don't have that granular detail on me now.
So just to expand on the Honourable Minister's comments, the 3 newly discovered patients, or those who are identified, are all currently stable, and they are currently in isolation, being followed up by the relevant county medical officers of health and, of course, the chief medical officer on whose behalf they act. Thank you.
Thank you very much. We now move to IETV. We're ready for your two questions.
Good day, everyone. Bina here from IETV News. I have 2 quick questions, either for Dr. Richards or the Minister. Are COVID patients who would have passed away at hospital or otherwise as a result of the Delta virus, are they being tested? That should be not the Delta virus. As a result of the COVID-19 virus, are they being tested for the Delta variant? And if not, is this going to be considered? Also, with regards to parties and gatherings, has the Ministry been in recent contact with the TTPS to ramp up patrols or implement any additional measures? For example, setting up camps within the hotspots in a bid to ease up on the gatherings. Thank you.
So I'll take the second question first, and Dr. Richards will talk about testing. So the TTPS, as you know, is the agency responsible for enforcing the public health guidelines, and I would suggest you pose that particular question as to how they operate directly to the TTPS. But we work closely with them all the time. Thank you very much.
Thank you for your question concerning testing. The Ministry of Health has a protocol in terms of testing for the Delta variant, and at this point in time, we continue to be guided by that protocol in identifying persons who potentially may be carrying the Delta variant. Thank you very much.
And thank you, Dr. Richards. We go to Guardian Media Limited now for your 2 questions. Thank you so much.
Hi, my name is Sunny Gray from Guardian Media Limited. My first question, I think, is for the Health Minister, actually, that one of the main things parents are concerned about in relation to getting their children vaccinated is that they are alleging that there's a waiver they have to sign that clears the government of any responsibility should something have happened to the child. We wanted to just get confirmation on if that waiver exists. My second question is about the Tobago MP, Ayana Webster Roy. She has a breakthrough infection. So we wanted to know what vaccine she took and if there are any concerns surrounding particular infection, any medical concerning her infection. It would be helpful if the ministry could define what do you consider to be a breakthrough infection of COVID-19 and a vaccine. Thank you so much.
Thank you. So on the question of parental consent, the forms clearly state that we are seeking parental consent to vaccinate your children. The government of the Republic of Trinidad and Tobago, when it brings in vaccines, has an indemnification clause in all of these agreements, which falls under the general rubric that the state, will assume some form of liability. So that is what happens there with that waiver. On the issue of Ayana Webster Roy and her particular vaccine, I really don't know which vaccine she took, but breakthrough infections can occur with any vaccine. But I don't know which particular vaccine she would have taken. As you know, I'm not saying that she took this one. We would have made the AstraZeneca vaccines available to all parliamentarians, senators, local government officials when we had the AstraZeneca rollout back in around May. I took the AstraZeneca vaccine. The Prime Minister is on the public record as saying he took the Sinopharm vaccine. That's in the public domain. Many parliamentarians and senators, local government councils, and media, we made it available to the media in those early days when all we had was, in fact, the AstraZeneca vaccine. I don't know if Dr. Richards has anything more to add. No? Thank you very much.
Thank you very much, Minister. We go to TV6. We're ready for your questions. Good morning.
Good morning, Vanessa Cutting, TV6 News. Could we have an update on the investigations into the two most recent cases of adverse events following vaccination? And on that note, and I know that this information may not be readily available, but if I could have it furnished, I would really appreciate it. Could the ministry say how many cases of bleeding disorders, whether it be clotting and or hemorrhaging following vaccination, that the ministry has had to investigate, and of that number, how many the ministry would have determined to be as a result of the vaccine as opposed to some other cause, please?
Thank you. So as I stated earlier, we have given out 1 million shots of vaccines, and out of those 1 million, we have had 5 adverse events, all of which are investigated. The CMO would have indicated on Monday that all of those adverse events, especially those that had some sort of DVT or any sort of blood clotting issue, have all resolved, and as the CMO said, they are all doing well. In speaking to the CMO again this morning, we can confirm that all our investigations to date, including investigations up to yesterday, and we can categorically state that no one in Trinidad and Tobago has died, passed, demised, after taking any of the COVID-19 vaccines in Trinidad and Tobago. There has not been one death attributable to COVID-19 vaccines, and as we continue to be transparent, we have said that of the 1 million shots administered, 5 have resulted in adverse events, and all, to the best of my knowledge, have been resolved, especially those that deal with blood clotting. Takeaway message is that 1,400 Trinidadians and Tobagonians have died from COVID. 4.6 million people around the world have died from COVID. 6 billion shots of vaccines have been administered around the world. So the takeaway message is that vaccines, the benefits of vaccines far, far, far outweigh the minuscule risk. and we continue to urge people to get vaccinated. Thank you very much, Renessa.
Thank you very much, Minister. We now go to Power 102 FM. We are ready for your questions.
Hi, good morning. Gregory McGurney from Power 102 Boom Champions and 102.3. My question today is regarding persons who are on either immunosuppressant drugs or immune boosting drugs. Persons with HIV/AIDS, for example. Is there a contraindication with any of the vaccines, and what's the science on the use of the vaccines for persons on either of these immunosuppressant or immune boosting drugs? Thank you.
Oh,
Good
okay.
morning.
Yeah,
Dr.
I'll take the question, Dr. Deyalsingh here. So, in terms of the advice, all persons, unless medically contraindicated, are eligible for vaccination, and you will be guided, of course, by your individual doctor and your individual case. What we have noted, however, and this is a worldwide phenomenon, if you're on immunosuppressive medication or have such a condition, then you are less likely to have as high a level of protection from the vaccines. But this is still under review, and the advice is subject to change. I hope that answers that question. Thank you.
Thank you very much. We now go to the Newsday. Newsday, we're ready for your two questions. Good morning.
Yeah. Hello. Good day. My question is, in light of the statements about rather few adverse drug reactions being reported, what actually is a mechanism for members of the public to report any problems such as bleeding or swelling and so forth? Is there a hotline? Has it been publicized? Are people aware of what the mechanism is for reporting any ADRs? Thank you.
Okay, thank you. So I will deal with that question on a policy level. The question of reporting for adverse events or side effects for vaccines in Trinidad and Tobago is decades old, but I know there's a heightened concern because of the COVID-19 vaccine. There is something called the ESAVI system, ESAVI. It's an acronym which simply means events supposedly attributable to vaccines and immunization. It used to be a paper-based format. It is now an electronic format where all health centers, all hospitals, all private sector physicians, all A&E rooms go on and report any side effect or major adverse event. What we are really wanting to track is the adverse events via this ESAVI system. It is available to all doctors, all A&Es, all health centers. These reports are then automatically sent to what is called the EPI, Expanded Program of Immunization, which is headed by, who is well known to the public now, Nurse Grace Sukchan. Reports are generated on a weekly basis, which are then sent to PAHO. The CMO will then send it and forward it to either the manufacturers if he deems it necessary, and to the IHR at WHO. So that is a system that has been in use for decades. The ESAVI system, but because of the COVID-19 vaccines, we pay particular attention to it, and that shown is the reporting system. It goes to PAHO, it goes to WHO, and it will go to the manufacturers if warranted, by way of weekly reports. Thank you very much, Sean.
Thank you very much, Minister. Ladies and gentlemen, that's all the time we have for our question and answer segment. We thank the media for their engaging questions, and we certainly hope that the public would take heed to the information presented this morning by our subject matter experts. People, instead of relying on the misinformation often shared on social media, please rely on reputable sources for information such as the MOH, PAHO, WHO, and even information from the Communications Ministry, CDC. They all have accurate and up-to-date information. We have come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. If you haven't received your COVID-19 vaccine as yet, please get yours now. Don't hesitate, vaccinate. Goodbye for now.
I